Hey guys, Coach Steve here. We're back with another P10 partner, and I'm here with my friend Carl Miluso, who is owner of CM Wellness Method, a massage therapist that actually without known throughout the Northeast, but local here in Port Washington. He has been tremendous in putting me together for runs and helping putting me back together after runs. And I just wanted to get a chance to introduce him to everyone, let him talk a little bit what makes him unique in his approach as a massage therapist. I've been to different massage therapies over a lifetime, and I can hands down say that the most effective, efficient, and best care that I've ever received when it comes to massage. And again, that knowing how deep to go, what the body needs is unbelievable. So I'll shut up and I'll let you talk a little bit about what you do.
Well, I've been a massage therapist for 24 years, and with each client, it's different. It's not all the same. I try to digest as best as I could as far as their daily activity. If they sit at a desk all day, if they run from Montauk to Manhattan, so I try to tie everything in, even how their sleeping patterns, their diet, and their gait when I first meet them, how they hold themselves, and I try to tie that all in. And then from there, I will assess the whole body. And I feel like everything's connected through fascia lines and connective tissue. So if you might have an issue with, if you have plantar fasciitis, I'm not just working on the foot. I'm working from the hip down, the hip flexors. I'm getting all the muscles that work its way down, and try to make one fluid motion out of all your joints and connect everything like that.
And forgive me, as a physical therapist, we are introduced to parts of
Yeah.
massage for
Yeah.
therapeutic techniques. You've been doing it for 24 years. Are you traditionally trained in a certain type of massage, or is there other certifications that you've done through the years of specialties that you've done?
I attended the New York College of Health Education and Research back in a while back. So in there, we were taught a specific massage called AMA. Now it's predicated to the lines of what an acupuncturist might use. So we learned a lot of acupressure points, the same points that an acupuncturist used. So I've taken a little bit of that. I've taken a little bit of everything. My massage is basically an eclectic blend of stuff. So, but I do deep tissue. I'll blend in those acupressure points. I'll use trigger points when needed to open up muscles. A lot of myofascial work. I'll do some dynamic stretching, but I'm really looking at the root cause of what's someone's major complaint. I'll just focus more on how I can fix their ailment without working solely on that specific area. And there's a lot of intuition that goes with that, but I'm just trying to make the body more fluid. And for you as a runner, I think it helps working into joints, working into all the joints, just to make that a more fluid motion for you.
It's been huge for me from the running perspective with the legs, or just dealing with old shoulder injuries and back injuries from years of
Yeah.
rowing, that you've been able to help alleviate and allow me to cross train to better prepare for running.
Yeah, and I'll look into that also. I'll ask, the person I'm working with, if you had past injuries or surgeries, which is very important. After a surgery, the body starts to compensate. Different muscles come in to compensate and help out that area to keep it intact. So with you as a runner, I'm always looking at total motion. It's probably from like a kinesiology standpoint. A person that plays tennis every day, person that cycles every day, or golfs. I'm looking at all the muscles involved to try to work on them, like I said, to make a more fluid, connective motion.
Some of the stuff that you've done, I think you mentioned the deep
Yeah.
tissue
Yeah.
as well. Like that deep tissue, like how do you know how, I mean, it's how deep or how, like everyone has a different tolerance, I'm sure,
Yes.
but even like that give back from the muscle, like how do you learn that?
Well, the muscle basically tell me how deep I can go. There is a certain degree that it will bend that I'll be able to know how deep I can go. It's really hard to explain, but I really try to stretch out that muscle, going along the fibers of the muscle, cross fiber, or direct application, but the muscle will usually tell me how deep I can go.
And obviously, with 24 years of experience, it becomes almost second nature a little bit to you.
Yeah.
Really. Now, in those 24 years, like I selfishly get the benefit from an athletic standpoint and putting myself back out there to be able to perform. But I'm sure you've dealt with clients of a range of age, fitness, and diagnoses. What are some of the different type of ailments that you've worked with people?
So I've done a lot of post-surgical work, hip replacement, shoulder replacement. Probably the most common is probably the shoulder and hip post-surgery work.
Is that working on the scar tissue as
yeah,
well?
Opening up the scar tissue right after surgery. That's probably the best thing. Is so once that scar tissue forms, then compensation will happen. That muscle will tighten up, and decreased mobility will happen. So I really try to focus on those areas to try to increase mobility through the work, through acupressure points, through some myofascial release or trigger points, but really working that area and opening the joint up. It's sort of an out-of-the-box type of approach. Mm-hmm. It's not really a textbook approach that I use. I'm always trying to look a little further on what the client has that I can utilize that would help out.
Look, and I think that says a lot because in any profession, whether it's massage, chiropractor, physical therapy, like if you're refined or restricted to just doing what's in the box or in the book, you're limiting yourself as sometimes the best treatment that you can give your patient or client. So the fact that you have 24 years of knowledge, that you're looking at everything out in the box as well as outside the box, it allows you to provide even a more thoughtful and probably productive session for the different people that you work with.
Yes, absolutely. I mean, I'll even go as far as a recommendation as far as diet and making sure what they're intaking has less sugar, foods that don't cause inflammation. I mean, that's a whole different aspect, but I really think that's important to try to combine into everything. If it's someone that I see quite often, then I'm definitely recommending diet, sleep patterns, and supplements that would help with their body.
And it's interesting that you say that because we a while back we did an interview with a chiropractor, Dr. Deb Senrich here, and she was talking about the chiropractic care, but she also talked about the nutritional parts that as a professional, like you have to look at the whole body and everything that's there. So the nutrition aspect of it, you talked about the supplement aspect of it, the sleep patterns, everything you're looking at. So out of curiosity, for everyone who's watching right now, like what are, 3 to 5 of some of the most inflammation type foods that are out there that you try to tell people to avoid if they have that?
Well, that's a good question. And I really feel that some of these that I use really helps out myself. So I've recommended it to my clients and anybody I run into. I've gotten rid of gluten. And since doing massages for that long, my joints really hurt me. And I feel arthritis coming on. But for me, kicking out gluten, getting rid of dairy, little to no sugar, those things have really helped me with inflammation. And I've experimented with other things. And it may not work for everybody, but for me, it definitely really helped out. I recommend magnesium glycinate all the time. It's really good for your muscles. And if you're tense or have anxiety.
And that's an oral?
Yeah, it's a supplement. It's a mineral.
Okay.
Magnesium glycinate. It's also one of the electrolytes. And most people are deficient in it, especially women. So it's a great supplement. I recommend it all the time.
And I think, and you're saying for the muscle, and you were talking about sleep patterns also, but I think magnesium is important for sleep also,
yes.
Correct?
It's great for sleep. It's great for recovery. And I even combine that with D3K2 to help with absorption.
Vitamin D.
Yes, vitamin D3K2, yeah.
Okay, and then with the magnesium, is there any certain types of rubs or anything on the muscles to help that are beneficial utilizing that?
Yes. There's definitely a magnesium balm that we know someone who makes it. So, but yeah, the magnesium balm is definitely really good to use. It has a quick absorption. You could use it before you go to sleep. It's great for sore muscles. It has a lot of benefits.
You're your own best guinea pig, right? So
Yeah.
you're a guinea pig in regards to the sugar, the gluten, the magnesium aspect, and it works for you. And there are definitely studies out there that these are inflammation causing type foods. So
Yeah.
to be able to test on yourself and then refer that out to your patients is invaluable.
Yeah, and that just reminded me of being my own guinea pig. Is I've had several surgeries which I've learned about my body, and it has helped me work on my clients. And I like, for example, I tore my Achilles. I had surgery with that. I tore my meniscus. I had surgery for that. I tore my rotator cuff muscle, the supraspinatus. I had surgery with that. So with all those surgeries, I really dove into what the body really needs. And I think, oddly enough, because of those surgeries, it's helped me work on clients with similar surgeries.
Yeah, that's
And
phenomenal.
and for example, when I tore my Achilles, my right Achilles, soon after that, I was warned by the doctor too, the surgeon. He said, "Be careful of your opposite side hip." So at that moment, it didn't really sink in. But when you think about it, you're leaning on that side a lot. So to avoid, or you might have a boot on for a while, but just out of second nature, you're leaning on the other side. Now your opposite side hip is doing most of the work or working harder than it's used to. So now your hip tightens up. Your quadratus lumborum, the lower back muscle, will tighten up. So now everything comes in to compensate. And all of a sudden, now you have a different area of your body that starts to tighten up and move around. So with those surgeries, it's helped me learn more about my body, which has helped me work on other people and what to look for.
No,
Yeah.
again, 24 years experience,
Yeah.
all the different ailments you've done, you're on your own self, having that valuable knowledge, using yourself as a guinea pig, and then the plethora of clients and the different injuries and ailments that you've seen has really helped you refine your skill to bring you where you are here today.
Yes.
And I'm selfishly very grateful for that because that's been huge for me. But I want to thank you. Again, this is Carl Miluso, CM Wellness Method, massage therapist. If you know, you know. Carl is the man. He is amazing with, like you heard, post-injury, rehab, just keeping you put together and helping you with your day-to-day wear and tear. So I want to thank you so much for coming on
Thank you, Steve.
this round of P10 Partners. And thank you for everything you do for me.
All right. And we'll continue doing that.
Absolutely.
All right.
Thank you.
Thank you very much.